Pulse field ablation technology is arguably the most exciting development in atrial fibrillation management, certainly in ablation terms in the last 10 years. It's probably helpful to think about how it works in comparison with the previous tools that we've used. So we started with radiofrequency ablation, which we use a catheter to cauterize tissue to create our barriers for electrical conduction. And the next way of dealing with things was to use a freezing tool, a cryoablation balloon, as it happened for atrial fibrillation. And pulse field technology uses very strong electric fields, really very short bursts of shocks to the heart muscle tissue at close range that damages the cells in a non-thermal way. So this is a major advantage because the key concerns we have in an ablation in terms of risk would be injury to tissues around the heart. If we cauterize or freeze, we can injure tissue like the esophagus or the nerve tissue, the nerve to the diaphragm, for instance. With pulse field ablation technology, that's eliminated. We don't have those risks. That makes ablation a much better proposition for a patient in terms of treatment earlier because the risks of that procedure are going to be lower. Well, we see it as being the most likely way we will do a first ablation procedure for almost all of our AF patients. So the tool will be used to disconnect the muscle of the pulmonary veins in exactly the same way that we do an ablation with radiofrequency or cryoablation, but using a different energy delivery. So the procedure will have the same strategy, but with less risk. The data that we have over the last few years, mainly from overseas, but some local centres, suggests that it is at least as effective as what we have been doing, and probably that with evolution of the technology over time, it will improve our initial ablation success rates. So in summary, the major advantages we see with pulse field ablation technology in comparison to what we have been doing will be that the procedure is quicker, the patient is under anaesthetic for a shorter period of time, recovers quicker, the risks of the procedure are significantly reduced, and success rates are at least as good, if not better, than what we have been doing. Basically, we see this technology being the initial ablation strategy for the vast majority of our patients moving forward, at least for atrial fibrillation. There will be some patients with non-AF rhythms that we will be thinking about using pulse field ablation technology, but that's an evolving space.